All right. We are down to our last two section of our webinar. So for professional values, the only thing you have to do on this section is to write, okay? To breathe and to write, okay? You will be given 10 minutes to complete this section. So there are a couple of scenarios for this section. There are 5 scenarios for professional values, which confidentiality, drug error, possible abuse, professional confrontation, and social media, okay? So we will talk about the criteria in my coming slides, in the next slides. Oh, there is a scenario. Do you know what, guys? This is our little secret. If you go to the website of, let's say, Oxford Brookes University and the other test centers, the answers are already there. So you're basically memorizing the answers. Okay? This is our secret. The things written on your marking criteria are the things you have to write on your professional values. You need to just memorize it. I hate to say the word memorize, but that's the reality. You really have to memorize it. So the only things that you remember when you're answering your professional values is if it's possible, paraphrase it and to make sure to highlight the keywords on each criteria. Okay, let's talk about the criteria first before I read the scenario. It's confidentiality. So the first criteria for confidentiality is to outline and provide reassurance to the patient of professional responsibility to respect the patient's right to privacy and confidentiality in all aspects of care, but outlines the need to act with honesty and integrity at all times, which is the duty of candor. So for marking criteria number 1, make sure to highlight the word or the phrase duty of candor. Okay? So to be able to get a pass mark on this section. And of course, you have to respect the patient's privacy. Next is the second criteria. Explore the patient's reason for withholding diagnosis and prognosis from the partner. Number 3, you have to offer the support and time to facilitate the discussion between the patient and the partner, respecting the patient's decision linked to duty of candor and confidentiality. So make sure that this will appear on your document. Okay, so I hate to say the word, but you have to memorize this. Number 4, documentation. Of course, the patient's wishes regarding the diagnosis and information sharing. You have to acknowledge the patient's concerns and feelings, acting with care and compassion, but explains the need to respect the patient's right to privacy and confidentiality in all aspects of care. And lastly, you talk about the code. Okay. So this is our scenario. Okay. All right. So let's read the scenario and then let's do let's say an example after this. Okay. The example is you are working in an outpatient's department, been asked to assess a 20-year-old accompanied by her boyfriend. She presents with pain when peeing and unusual vaginal discharge. After her boyfriend leaves the room, she admits that she had been seeing another guy and tells you that she had an unprotected intercourse with him a few weeks ago. Her boyfriend doesn't know about it and does not want her boyfriend to know the result of the test and assessment. Tests came back and there is an STI or a sexually transmitted disease. This patient has requested that you not convey the results to her boyfriend. In other words, she has requested that you respect her confidentiality. Using your knowledge of the NMC, the code, professional standards, and practice of behaviors for nurses, midwives, and nursing associates, consider the professional, ethical, and legal implication of the situation. So the main tasks are the following. So please summarize the actions you would take in a number of bullet points. This is a silent written station. Please write clearly and legibly. You have 10 minutes to document in this station. So Emma, where is the answer? It's on your left hand side of the screen. Okay, so hopefully that's useful. The answers are already written on the marking criteria. Okay, so Emma, probably you're thinking, so how are we going to write this? Okay, let me just show you the other screen, the next slide rather. So this is the example on how you're going to write this. So I did not write everything, yeah? I did not write everything because you could just, because this might be your answer in your examination. So I just provided a couple of examples. So on the screen, on the left-hand side of your screen is the actual paper that you will be using on your examination. Of course, let's say that's your name. Let's pretend you are Joe Rizal. Okay. So let's compare that the answer to the marking criteria. Let's talk about number two. Of course, if the patient has STI or STD, let's start with number one. Outline and provide reassurance. Of course, you have to reassure the patient, okay, and make sure to respect the patient's privacy and confidentiality in all aspects of care. And you have to act with honesty. It's a hard conversation. Have you had a conversation with the patient who's got STI and you don't want to tell that information to the patient's partner or boyfriend? Okay? Or let's say one of your patient came to you, oh nurse, I have AIDS and my husband doesn't know it. Okay? So what if you are in that situation? So what are you going to do? It's a difficult conversation. I don't know, any one of you guys in this call had this kind of conversation with any of your patient? It's hard, difficult. So far for me, in my couple of years experience as a nurse, I never had this kind of instance, but probably some of you had this kind of conversation, not STI or HIV in particular, but like a difficult conversation wherein you have to keep a secret. Okay, these are the things that you need to write in your examination. Then let's say number two, you have to explore the patient's reasons for withholding diagnosis and prognosis from the partner. So how am I going to write this on the examination? So the one on your screen, I will explore the patient's reason for withholding the results of the test and the diagnosis of the sexually transmitted disease from her partner. So see, actually, I just paraphrased item number two in here. Okay, it's the same thing. If you look at it closely, it's the same thing. I just paraphrase it. I just added couple of information. Okay, so that means the marking criteria tells you the answer already. Number three, let's say, offer support and time to facilitate discussion between patient and partner, respecting the patient's decision linked to duty of candor and confidentiality. So the example of what you're going to write on your paper is as below, or on your screen rather. I will offer appropriate support and time to enable conversation between the patient and the partner, upholding the patient's decision linked to duty of candor and confidentiality. Is that easy? Yeah, that's easy. I just jumble the words and then just paraphrase it. Okay, use synonyms. That is it. Okay, so make sure all seven will appear on your paper. Okay, so from now on, if you're taking a UTAS competence, you have to start memorizing these, the marking criteria for professional values. Again, you have 5 scenarios. Make sure you start memorizing those criteria from now on. Okay, number four, another one, let's say, document the patient's wishes regarding the diagnosis and information sharing. So what you would write, probably write on the actual paper is, I will document the patient's wishes regarding the diagnosis and information sharing. Okay? Any question in terms of how to write your professional values? That should be easy, right? But it's not easy if you're memorizing a lot, Emma, of course. Yep. And they say, but you have to explain the need to respect the patient's right to privacy and confidentiality in all aspects of care. And of course, you have to mention about the code. Emmer, could we also add? Of course, you could add, but make sure it's relevant on the scenario. Okay, it's relevant on the scenario. So what part of the code should you write on this particular scenario? Could we write, let's say, acknowledge the need to keep to and uphold the standards of values and set the code? So what part of the code? Is it prioritizing people? Is that applicable? Of course. How about, are you practicing effectively and safely? Of course. And are you also promoting trust and professionalism? Of course. You're actually, um, everything will be part of this. Any question in terms of confidentiality? No question. All right. Let's move on. Another, so this, the next one is another example, and then for the remainder of our scenarios, I will be showing the marking criteria because I think you know now how to answer it, right? So next is drug error. Okay, so drug error, let me read the scenario first. So you are working in an acute medical unit and you just receive a handover from the morning nurse You have taken over the bay and have started doing your drug rounds. You have prepared and administered an antibiotic to your patient just now that was given 3 hours ago, which you have missed to check. The prescription clearly says it is to be given every 12 hours. Oh my God, you will be in trouble. So, using your knowledge of NMC, the code, professional standards and practice and behavior for nurses, midwives, and nursing associates, consider the professional, ethical, and legal implication of the situation. Again, the instructions are, or the, yep, what's required of you are the following. So, this is a sudden station. Please write clearly and legibly. You have 10 minutes to document on the station. So let's talk about drug error. Okay. So this might happen to you, or probably this had happened to you already. You've committed a drug error. So what are the things you have to perform, or what are the things you have to do? Number one on the marking criteria. Okay, this also applies in reality or in real life or in clinical practice. Number one. So of course you have to recognize the possible consequences of the error and the importance of patient safety and takes measure to reduce the effect of the harm. Of course, you have number two, you have to check the stability of your patient by taking observations and inform the nurse in charge and the medical team of the event and seek advice. Of course, if you committed an error, you have to go to the patient immediately and check the patient if the patient is okay. Of course, you could do that by checking the patient's vital signs and check if the patient is stable clinically. So that is your next step. Okay. And of course, you have to highlight that you have to seek um, advice from your nurse in charge. Of course, you have to notify your nurse in charge or your manager, and of course, the rest of the medical team who could check the patient as well. Okay. So number three, you have to recognize the importance of disclosing the occurrence. The patient to the patient and of course to apologize and to reflect the duty of candor. Of course, that is the patient's right. If you committed wrong, um, committed something wrong to the patient, you have to say sorry. Okay, we have to apologize and we have to um tell them the truth. Okay, so that is it. That's one of your patient's right. Of course, the right to know what's happening to them. So number four, so you have to document the event, of course, the actions and the consequences in the patient's records and complete an incident report. So last week in our previous webinar, I talked about DATEX. So in the UK, we do use the DATEX. So DATEX is the equivalent of incident reporting. Remember, guys, incident reporting is not to blame someone. The main reason of DATEX is to improve the practice and to prevent this situation from ever happening again. So the DATEX is for us to learn something, to move forward, and to prevent this from ever happening again. So next is demonstrates the importance of reflection, explores the sequence of events and factors that may have influenced the occurrence, recognizes the learning opportunity, and identifies the need to revisit drug administration procedure. Of course, um, after having this kind of event or situation, what are the things we learned from this? Okay. So we have to reflect, okay? Learn from our mistakes and we move on. Okay. And of course, if we need to revisit the protocol for drug administration, we have to. Okay. So make sure that is written on your answer in your professional values for drug error. And lastly, of course, again, the code. So prioritizing people, practicing effectively and safely, and promoting professionalism and trust are all appropriate for this particular scenario. So Emmer, what are the things we need to write on our paper? I will give an example. Again, all seven or all six should appear on your paper. Okay, but I will just give a couple of examples. So these are the examples. So for example, for marking criteria number two, so you could write, I will immediately check the patient's clinical condition by taking observations, informing and seeks advice from the nurse in charge and the rest of medical team. Again, if you look at this, I just paraphrase this. I just use synonyms and I just jumbled the words. Okay. For number five, an example is I will reflect on the situation by analyzing the sequence of events, the factors that may have influenced and led to it, and the things I have learned from this event. I will revisit the drug administration protocols and procedures accordingly. Okay. I hope you're getting now the formula on how to answer your professional values. Okay. any question in terms of drug error. That should be straightforward. So again, guys, you have to so again, guys, I'm not writing everything, but you have to write everything on your examination. You have to write 1 to 6 for you to pass. If you missed any of this marking criteria, you will fail the examination.